Okay, welcome everyone. My name is Bob Etemad, and welcome to Valley View University. I'd like to thank everybody here for joining today. I have a few housekeeping items before we start. One is you can submit your questions to the Q&A chat on the bottom of your screen. Your question could be answered live at the end of the presentation. We will try our best to answer your questions, and we are unable to answer all questions uh, if or any questions that involve personal information. So please keep that in mind as well. Okay, great. All right. Well, today's topic is the microbiome, how food and diet can cure disease and improve your health. I thought it would be a helpful topic for us all because the microbiome is something that is talked about a great deal in the lay media, and it is something that is likely to be talked about even more because um, it is something that we literally carry with us every day of our life. We have something within us that is alive, that is an important part of our health that we previously never really paid a lot of attention to. And as I'll go through some of my slides, I hope will demonstrate to you may be a very important part of a life from the very beginning of life until our later years. I wanted to just give a quick acknowledgement to the providers of our team here at Valley View Hospital. We have a wonderful group of advanced care providers and gastroenterologists who are helping to serve the needs of the community. We are a small team, but we, alongside the people that are working in the office and our administrative associates, work very hard to address the many thousands of patients that are coming through for both endoscopic procedures and office procedures. So we continue to grow, and I want to acknowledge that it really is a team effort as we move to serve our region. So, a little bit about the microbiome. Um, you are more microbe than human. We have, as you probably knew when you grew up, you have this stuff that comes out of you every day or roughly every day that is full of microbes. And these include bacteria, fungi, and viruses. And these actually, rather than just being waste products, are very important in how some things are digested. It plays a significant role in immunity and may even have a role in our in our mood and how we feel about things in general. There is growing data that the microbiome helps to prevent disease and addresses the issue of inflammation, obesity, diabetes, and other things. And I'm going to be talking a little bit more about that. What you eat has a powerful effect on your gut microbes. And so we want to talk a little bit about how diet has a role in this microbiome of yours and all of ours. So we'll address lifestyle, diet, and early life exposures. And I hope that it will give you just an introduction on this topic, and that you will then go on to explore more on your own as to what the latest information is. So we're going to talk about what it is, how it functions, the connection between gut health and disease, how different foods might impact it, and what you can do to optimize your own gut health. So again, we have a lot of different types of bacteria in our colon and in our small bowel and in our stomach. And the actual numbers are larger than the numbers of cells that we are actually made of. When we talk about the types of bacteria or microorganisms that are in us, it really depends on where we're talking about on our body or in our body. We can see that our skin has a certain type of group of microorganisms, and that's different from the ear canal, or different from the mouth, or different from the esophagus, different from the nasopharynx, different from our urogenital organs as well. So this is an important discussion, and each one may be important as far as their mix and how they either promote health or lead to problems. I'm going to be primarily talking about the microbiome as it relates to the gastrointestinal tract, and for the most part, talking about the colon where the concentration is highest. There are many different things that the microbiome has been shown to do. The microbiome provides an intestinal barrier function. And what that really means is that if you imagine your body is basically, you have this covering that's on the outside. And then if you go in through the mouth and you come out through the bottom, that's one long tube. If you were to swallow, for example, a string and you just let it travel through you and it's weighted, it will literally come out of the bottom after about 20 feet or so. That tube is seeing a lot of foreign material. It's what you eat. It's how you might swallow things that are from the environment. Those things that are going inside of you need to be protected, uh, meaning that the rest of your body needs not to see all of those things. Um, and to prevent that, there needs to be a barrier, an intestinal barrier, to protect you from all of these foreign antigens or foreign proteins that you're ingesting. And so that intestinal barrier has a significant role in inflammation. Remember, inflammation is something that is associated with the body seeing danger, seeing something foreign, seeing something that doesn't belong. So many foods are perfectly reasonable to pass through us. Some things are actually a little dangerous for us. It is the responsibility of the gastrointestinal tract to sort out red light, yellow light, green light, what is dangerous, what is not. So the barrier function is very important. There are some things that the regular gastrointestinal tract is unable to digest. And so it is the microbes in the colon, for example, that are helping to further digest these things with the tools that they have available to them. And then it then provides you with nutrients from those things. The immune system is activated or calmed down by how the gastrointestinal tract samples these things that are in the gastrointestinal tract and then determines what is safe and what is non-safe. And we'll talk a little bit more about that. There's actually metabolism going on in the small bowel and in the large bowel that is assisted by the microbiome. That is, there are certain continuations of our normal physiology that require this healthy microbiome to do it. Protections against infection. You can imagine that if you have certain things that are appropriate to be there that are missing, that it may lead to infection. And then, of course, how drugs are metabolized can be impacted by the microbiome. So these are basically, as I mentioned, these are the things on a medical standpoint that are important: digestion, motility, gut immune regulation, the protection of the intestinal barrier, homeostasis, body homeostasis, energy homeostasis, meaning sugar, and how we utilize the energy that we're actually taking in. The various dietary components, and that is our amino acids, our fatty acids, those are very important. Uh, the balance of those things and how they are absorbed are managed to some extent by the microbiome. Drugs, other foreign things that are brought into our system. And then neurotransmitters, uh, antimicrobial peptides themselves, vitamins, amino acids are actually synthesized in the microbiome. And then we have this fascinating gut-brain axis where actually we have direct communication with hormones from the GI tract to the brain that help us to manage both what we eat and actually impact how we feel. And so this is something that we're learning a great deal about, and the microbiome also plays a role in that as well. There are some general concepts that I thought were important to share and to remember and to balance what is sometimes in the lay press. Biodiversity equals resilience. This is a general principle that we know of both in nature and in our microbiome, and that is a diverse microbiome is more stable and better able to resist invasion by pathogens. Diversity generally prevents dominance of any one harmful species, and a higher microbial diversity seems to be associated with a lower risk of certain disease states, including inflammatory bowel disease, certain allergies, and cardiovascular disease. So you're going to see in the literature, as you read on your own, that there is generally we're looking to see that there is biodiversity in the microbiome, in all of this bacteria that is in our colons, and that we want to preserve that biodiversity. And we'll talk a little bit more about the conditions that lead to that. There really are no good or bad microbes per se. I mean, that's a general statement. There are some things that are generally pretty much on the negative side, but it's very important that we always keep it in context. Some microbes that are harmful only because they come to dominate the microbiome, not because they themselves are bad actors. And so again, moderation in all things, we want to be sure that we are promoting a well and diverse microbiome, and that one particular actor is not becoming dominant. So there are opportunistic species where you might find in a disease state, they seem to be more dominant. And then the question is, what came first? Did the disease state come first, or did the microbiome actually promote the disease state? Sometimes I think of the microbiome as an amplifier of disease states that are already present from other issues. But it may very well be that the microbiome is the primary issue when it comes to disease. So dysbiosis is when the microbiome is not balanced. And there are general things that happen in dysbiosis. One is this chronic low-grade inflammation. And inflammation, again, is where the body senses that there's something awry, and then it puts out certain types of white blood cells and signals from those white blood cells that basically put the body in this state of constant anxiety. It is worried that something may happen. And as a result, that state may then lead to other problems. The barrier, again, is very important because we're trying to constantly test self from non-self in our systems. And when the barrier is not working properly, the internal milieu of our system identifies things that it normally would not have identified because the barrier is broken a bit, and it activates alarms that say, danger, there's something going on that should not be. And that creates this inflammatory state and/or can drive autoimmunity. That's the issue of altered immune response, overactive or underactive immune system. And then that can then lead to metabolic dysregulation, which can affect a variety of functions moving forward. We know that this process starts very early in life. So, for example, vaginal delivery versus non-vaginal delivery, breastfeeding, physical contact, all of these things will play a role to the bacteria and to the microorganisms that you acclimate to very early in your life and moving forward. And the hypothesis that we're working with right now is that disruptions during this period may be linked to higher risks of chronic disease later. We joke about how children should maybe eat dirt and or be licked by their dogs and pets. And while we don't have direct data that is very strong to support that for everyone, we do see that allergy and some other disease states may be associated with early exposure to certain antigens in a positive way, and that may then reduce the likelihood of allergies in adulthood. What you eat is a primary shaper of the microbiome. Think of it a little bit as a you have this sourdough starter inside of you that's fermenting all the time. You feed your sourdough starter every day, and that stool, that poop that you're feeding every day is going to be modified by what you eat. And it's a different paradigm, I think. The poop seemed to be at least when my generation grew up, of course, poop was dirty and evil and you don't touch it. And I still think that's probably pretty true. We don't want our children playing with their poop per se. But I do think that we want to, as adults, recognize that this stool, as is passed out of us, is actually a sort of a living, synergistic organism that is has many parts to its whole that is actually important as far as its quantity and quality in our health. So we'll talk more about what foods are better or worse for that. At least what the data is suggesting is better or worse for us. So what is dysbiosis? Well, dysbiosis seems to be when we have reduced diversity, when we have opportunistic pathogens that are more than expected, when we see altered metabolic activity in the poop, and that there is a chronic inflammatory state. So these issues of over the long term creating a chronic inflammatory state, it does seem to wear down organs and systems as arthritis as an example, where we have changes in our joints as a result of chronic inflammation, or if we have eczema over a long period of time, how it will change the skin in the long term. And then we do see that there are chronic inflammatory states that may also impact neurotransmitters, how insulin is both secreted and managed, how general immune regulation is impacted by chronic inflammation, leading to potentially a risk of developing infections or opportunistic infections. And then this whole issue of heart disease, malignancy, uh, neurodegenerative disorders, and autoimmune conditions seem to be something that people are getting more interested in. So, what are some of the impactors of the microbiome? I just wanted to briefly go through this because I think that as I went through the list, I realized that from the very beginning, uh, we have things that we both can control and we cannot control that will, in fact, impact our microbiome. So, mode of delivery, vaginal delivery seems to be associated with a more diverse microbiome in children than cesarean delivery. It doesn't mean that things won't stabilize later on, but at least earlier in life, there's a difference. Gestational age and how old the baby is at the time of delivery may also impact what the microbiome will be for different young children, meaning a few months to a few years old. Breastfeeding versus formula feeding, again, it sort of makes sense, right? You've got skin flora already there. There is data that suggests that the having the child um, with the skin contact and the breast milk itself has a different impact on the immune system than formula feeding. Um, Perinatal antibiotic exposure, it would make sense again that if a child, for whatever reason, has to be exposed to antibiotics, it will significantly impact their microbiome. We talked about the skin contact, and then, of course, the maternal health and the maternal microbiome is going to have a significant impact on the child's. Then there are genetics. We just seem to see that there are certain people that are likely to have certain types of microbiomes. Um, your actual age, your microbiome will change with age. Your hormone status, whether you're uh, uh, postmenopausal or not, or what your level of hormone status might be, has an impact on the microbiome. And of course, the genetics that you inherit with regards to your own immune function will have an impact as well. And some of the things that we as humans can impact or control, it's our exposure to antibiotics, antifungals, antivirals, proton pump inhibitors, non-steroidal anti-inflammatories, glucocorticoids, of course, chemotherapy, artificial sweeteners, emulsifiers and preservatives and processed foods. And then we have our hygiene habits. Are you in a household that uses 99% reduction of bacteria and antivirals with the soaps that you use? Are you living in a rural environment or urban environment? It has been demonstrated that there is different microbiome associated with these two. Your size, siblings who you're interacting with, where you've traveled, where you actually were born, and then where you're living, and of course, your own dietary habits. I think that other things that are important that are that might be under our control is again the type of food that we eat, and we're going to get to that in a moment. But just to introduce the idea, fiber is a prebiotic. It can be a prebiotic in the sense that a prebiotic is something that feeds your microbiome. It's food for the microbiome. Um, Probiotics are the actual bacteria themselves, and postbiotics are the things that those bacteria produce. So pre is the food, the pro is the actual uh, microorganism, and the post is the product of the microorganisms. Fermented foods seem to be helpful for many issues like promoting the diversity of the microbiome. Processed food and sugar seems to have a negative impact on the diversity of the microbiome. Red meat and choline contact may also be associated with a lower diversity, as might alcohol. And then water quality and source, that's a whole topic in and of itself, too. What is the impact of the different types of water, whether there's chlorinated water or not, and how does that address the issue of diversity in the microbiome? This is actually one of my favorite areas of thinking in that when it comes to the microbiome, in that cortisol levels and the level of stress that is chronic stress that one experiences can have a significant impact on the microbiome, how well you sleep, and how much attention you pay to the quantity and of course quality of your sleep. Physical activity and exercise are definitely promoters of a healthier microbiome. Disruption of your sleep cycle and regular circadian rhythm can have an impact. Smoking and vaping both seem to have a negative impact on the diversity of your microbiome, where we live, environmental issues, and then, of course, what other live creatures are in your life are going to have an impact on your microbiome as well. Some of the things that I thought as you go and do your own research that you'll come to see is that there is a shift in focus right now from taxonomy. Taxonomy would mean sort of what do you have? What species are in your poop to functional outputs, that is the postbiotic material. How well is your microbiome functioning to do what it needs to do? Two individuals may have very different types of poop, um, but they actually have functional redundancy, meaning that each one in its diversity is basically doing what needs to be done. So, like anything in life, one size does not fit all. We're not looking for the perfect uh, poop when it comes to quality. We're looking for what produces those postbiotic chemicals, let's say, or products that are likely to lead to a healthy lifestyle and a healthy life. So decreased diversity, some, let's say, pathogens that are more likely to cause trouble. This is short chain fatty acid producing bacteria. Generally, when they're decreased, they're more likely not to help protect the gut barrier, feed the colon cells or the small bowel cells. And so we don't like it when there's a decrease in these bacterias. And mucolytic, there is a layer on our gastrointestinal tract made of mucus. It's almost like when you touch a fish and the fish is nice and smooth and slippery. That slipperiness is related to a mucus layer that's adherent to the fish. The same thing is true in our small bowel. If you have bacteria that are lytic, that are cutting that mucus layer, you're more likely to generate a disruption in the barrier, and that can be leading to more health issues. So, what are some diseases that are associated with dysbiosis or those issues that we just mentioned? Inflammatory bowel disease, Crohn's disease, ulcerative colitis, you probably are all aware that these are autoimmune diseases. And for decades, we have suspected that there is some issue with autoregulation in the gastrointestinal tract, where the GI tract is saying there's something dangerous here that doesn't belong. And as a result, there's inflammation that can be quite overt, cause bleeding, cause stricturing and narrowing, and infect other organs of the body. And so it does appear that there are different bacteria than might be seen in a normal microbiome in patients with inflammatory bowel disease. We wonder then, if we manipulate that, can we help people move along toward more normalcy by providing an environment of microorganisms that is more conducive to health? Irritable bowel is fascinating. As many of you know, it's a very common disorder. People feel sort of grumpy in the tummy after eating certain things, and it is often not an easy thing to fix. It's often related to changing diet. Well, we do see that patients that have irritable bowel syndrome, many of them have an altered microbiome as compared to the rest of I'm going to say people that don't have those symptoms. What is it? What came first? And what can we do about it? We'll talk about that. Colitis and microscopic colitis, that's when the colon might look normal, but you have diarrhea and you have a lot of diarrhea. It may very well be that the microbiome is either an amplifier of an underlying process or a trigger that leads to the issue, and we're learning more about that. Many of you know celiac disease is something that we talk about a lot, that is gluten sensitivity. Well, some people don't have overt gluten enteropathy. That is, they don't have the classic celiac disease, but they are more sensitive to gluten than other people. And when they discontinue gluten, they end up having a better GI life. Well, is that because there are some patients that have been identified that have a different microbiome that are gluten sensitive? Maybe it's not about the gluten by itself, but it's more about a generalized microbiome dysbiosis that potentially can be nudged in a direction that might help the patient. And we're still learning about colorectal cancer. As many of you know, colorectal cancer between the ages of 25 and 49 has really exploded I'm going to say in the world. Lately, a few months ago, data was presented that in developing countries as well as developed countries, we're seeing an explosive growth of new diagnosis of colon cancer in young people. Uh, the causes are not obvious. We do know that diets change as developing worlds move, I guess, to a more technologic society. Um, but is it diet related? Is it lifestyle related? Is there some other exposure that is in our lives related? We're still learning. Um, so if there is a way, again, to nudge ourselves and help ourselves toward a less likely environment where malignancies can form, then perhaps we should focus on those things that we can control with in our environment to make it less likely that the colon will see the things that push it toward a malignancy. And then C. diff, Clostridium difficile, is something that 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 is associated with antibiotics when antibiotics basically eliminate a large number of our healthy microorganisms to allow this particular bacteria to cause trouble. These are other things that have been associated with dysbiosis. And I say disassociated because in medicine and in science in general, we have to be very careful when we see two things that are happening at the same time. Just because, um, just because the ground is wet and the sky is cloudy doesn't mean that the clouds made the ground wet. It's that kind of analogy. We want to be sure that there that the associations are real in the sense that, well, if we're going to do an intervention, that the intervention is to the right thing, and that it's not just an association because you have one common element that's affecting two different systems. That's my point. So with obesity, type 2 diabetes, fatty liver disease, atherosclerosis, hypertension, depression, Parkinson's, autism, spectrum disorder, all of these disorders, I'm going to say, I'll use the word disorders as a catch term, um, are associated with dysbiosis. So what does that mean? Again, what came first? Is it the way that we take care of people in these issues? Are they visiting hospitals and healthcare providers, and that leads to the issue? Is it that each one of these is something that has a potential manipulatable uh, uh, a factor that might make each of these a little bit better? We're still learning a lot of that more. So rheumatoid arthritis, lupus, allergies, eczema, malignancies like pancreatic adenocarcinoma or liver cancer and breast cancer. I I mention them not again to be I'm going to say inappropriate to imagine that all of these things are going to be fixed with changing the microbiome. But the microbiome then is reflects disease state as well as maybe a contributor to disease state. It may be that we can learn about the disease states, each one of these, a little more by checking it out. And perhaps it will give us more clues as to the pathogenesis of the disease state itself. So we have all of these things. We have diet, genetics, biologic stresses, let's say, that then impact the gastrointestinal tract, then that have potential impact in these disease states. And it's on us, I think the healthcare community and then the general community to learn more about how can we How can we work together, both as community and as healthcare providers, to better understand this process and I hope bring people more to health? So, the big question, I think, to all of us is, does the microbiome, altering it, actually impact health? If we do something, can we make people healthier? This is what we know. Changing our diet can rapidly change the microbiome. We do know that. So we actually can manipulate it. There are links to these disease states. We have examples where we can, and I'll talk about this, where we actually can use changes in the microbiome to help people. And there seems to be some impact on diet to change some bacteria, and that we do see that people that have these particular diets seem to have other health benefits, including lower cancer risks, lower inflammatory states, etc. But which specific changes to the microbiome can cause disease, we're still learning. And what I think is a singular example, there are so many probiotics on the market. Each one of them is a little different. Knowing which one of these is going to impact somebody's specific symptoms is terribly difficult to know. And unfortunately, the marketing has gotten ahead of the science. And we are in this situation where, as healthcare providers, we see patients taking probiotics and we need to see what brand they are in. And we still don't have great science to know whether that particular brand or that particular bacteria or that particular combination of bacteria and fungus are going to be impactful to health. So we're still learning a lot about all of this, and we still live in a lot of darkness related to it. I think this is the best example of how we can actually help people by altering the microbiome. And Clostridium difficile is often a hospital-acquired infection, but can also happen at home after getting antibiotics. And what happens is a bacteria that normally is in the GI tract is actually taking advantage of the situation, and it colonizes more and it creates diarrhea and inflammation in the colon. And so, once upon a time, not too long ago, I'm going to say perhaps 20 years ago or so, we literally took somebody else's poop that was healthy and we put it inside the colon of somebody else. And we found that we actually could help people come back to a normal state when the routine treatments weren't working. You can imagine that it's a little bit anxiety producing to do that because there are many, many bacteria and many viruses and many other things that are in people's poop. So to give it to somebody else, having the notion that we're trying to protect people from infections is a bit of a anxiety producer for a healthcare provider or an infectious disease physician. But nonetheless, we do find that when we colonize people's healthy poop, and we either deliver it directly into the colon during a colonoscopy, or, as is shown in this picture, freeze dry the poop, put it in a capsule, and have people swallow it, we can actually get cure rates in excess of 85 to 90%, depending on the method. And it's actually FDA approved to sell poop in a capsule. So it is a fascinating learning here that we actually can use something that we previously thought would be not necessarily a therapeutic thing and have an impact on someone. We are working on the same thing with ulcerative colitis, that fecal microbiota transplants can induce remission in some patients with ulcerative colitis. And so we are trying to determine whether or not there are other inflammatory states in the colon where delivering stool from healthy people can help disease. I wanted to say it's a tough pill to swallow. Sorry for that, but it is something that we continue to learn about. With irritable bowel, many of you heard of the FODMAP diet: fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. These are foods that generally generate a little more gas than other foods. And you can look this up, but it looks like there are some people where their microbiome just generates more gas than other people when they take these particular foods. And so if we end up asking patients to be more selective in the foods that might be on a FODMAP diet, it may lead to improvement in their symptoms. And so that is often part of what the gastroenterology team will offer patients when they have irritable bowel. It's very interesting that this is other data that's coming up that when we look at children that have early eczema, that there may be a role for perinatal probiotic use with the idea that, again, babies are learning self from non-self, and the skin is often almost like a thermometer for the autoimmune system. It is determining what is active. And it may be that microbial modulation will help some children with eczema. So this is something that is ongoing in its research, but fascinating nonetheless. Um, there are small trials where using prebiotics may improve insulin sensitivity in type 2 patients. I don't think we're talking about necessarily eliminating type 2 diabetes, but we certainly are trying to find different ways of not using insulin, certainly, which has significant side effects when used in high doses. And so if we can whittle away glucose control and make it better with other things that are non-pharmacologic per se, that might be helpful. So I'm excited to see that we continue to work on this area. So can we change our microbiome? Yes. Remember, association does not equal causation. We're still learning how health and the microbiome are related. So this is what you can do. Eat a fiber-rich diet. Fiber is the primary fuel for the gut. It's a prebiotic. It supports short-chain fatty acid producing microbes. And there's a whole list of prebiotic foods that you can look at and find online that will help you to better perhaps lean into that if you're interested in doing that for yourself. This seems, when I look at the list, it would be on many other lists as well, including cardiovascular health. So that's one thing we can do. Fermented foods actually contain live bacteria, whether it's kefir or if you like sauerkraut. Of course, kombucha has become very popular, and sourdough bread can have it's the result of a fermentation, but incorporating fermented foods is one of the things that does seem to promote, again, the microbiome and diversity in the diet. I'm sorry, in the microbiome. This is a big topic, as many of you know right now. It ends up that avoiding ultra-processed foods is a lot easier said than done, in that probably in the United States, close to 50% of our diet is our calories are coming from processed foods or ultra-processed foods. There has been work to define what this means. The NOVA classification is something that came out of Chile, where they try to group these with the idea of helping both, I'm going to say, consumer and studies and researchers put things in categories to better understand this. Unprocessed, of course, being, I'm going to say, raw foods. And then you have basic sort of beginning salt, sugar, vegetable oils, butter. They have some processing. Then you have some things where they're bottled or they're in salt solutions. And then you have other things that are even more with more additives in them. And this is well described, the NOVA food classification, and I think that this re presentation will be recorded for you to review if you're interested in later, but you can look it up. This may help you to better understand the issue. Um, Many of you have heard of the Mediterranean diet. This is the pyramid of the Mediterranean diet, where you have sweets less than 3 times a week. You have red meat less than 2 meals a week, processed meat less than 1 time, white meat, eggs, dairy, olives, fruits, vegetables. They get more frequent and more of it as you come down this pyramid, and these seem to be more healthy as you're moving down. I think that there is a strong body of evidence that suggests that Mediterranean diet seems to have impacts in cardiovascular health, the microbiome, and in immunity and in inflammation. And so there's going to be probably increased interest in this in the community to move toward a structured approach when it comes to dietary guidance toward that Mediterranean diet. This whole idea of nutrients by themselves to whole food context, I think we're going to be seeing more of. I think looking at processed, non-processed, maybe a proxy for health risk. That is, are we actually going to label foods as being ultra processed or not? I'm again, there's a lot of discussion on this in public health as to how we can actually do this and how practical and realistic it is, and uh, what kind of who's going to decide how we're going to do all that. And what are we going to address for children, school lunch standards, national dietary guidelines, etc. So there is a lot of discussion now in the community as to how we're going to approach all of this. I think this is a no-brainer. I do think that there is that it used to be that patients felt very frustrated when they left the doctor's office without an antibiotic. I think those days have passed. I think that we're very much trying to avoid antibiotics if we don't really think they're necessary. I think whether it's diverticulitis or it's upper respiratory infections or other things that are ear infections, I think that to use providers that are being thoughtful and assessing the issues and up to date, I think we're hopeful that we might be able to reduce the use of antibiotics. And I think this is not only good for the infectious disease community, but but for the microbiome as well. Exercise, for whatever reason, also seems to have a significant impact on the microbiome. And so it improves the resilience of the microbiome, and it just seems to increase its diversity. And so, like anything else, regular activity has an impact on the microbiome. We talked about sleep and stress, and I think that there is more attention being paid in general to sleep hygiene, and I think that this is something for the microbiome as well. I will share that again, unnecessary gastric acid suppression is also going to be helpful for the microbiome. Many people are started on proton pump inhibitors, and then it's sort of not certain when to stop it. We are working, all of us in the gastroenterology community now, to be thoughtful about when patients are on proton pump inhibitors and when they should be appropriately stopped. So I think for you as a community, I think for you to be thoughtful about this, people need proton pump inhibitors many times. It's not inappropriate to use them. It's learning to use them wisely and in conjunction and with the thought with your provider to avoid the dangers of reflux, because they can be real, including Barrett's esophagus, esophagitis, strictures, difficulties swallowing, loss of teeth or loss of enamel, losing your voice, chronic cough, pulmonary issues. I mean, reflux can be a real problem. But we also want to be sure that we're thoughtful and that patients have heartburn. Are there other ways to prevent heartburn or reduce their heartburn without high-dose proton pump inhibitors? Because the antacids seem to have an impact on our microbiome. these things I think are really interesting as well. Will intermittent fasting and our time restricted eating does that have an impact on microbial rhythms and our microbiome? We're continuing to research this issue. Um, Alcohol is probably an important factor to address. Pets, we talked about before, and then urban versus rural living. So, in summary, living entity, the microbiome literally lives inside you. We want to be sure that you treat it well and with respect. It can promote health, and not treating it well can lead to disease. It can be manipulated, but the impact is not yet clear. And choices in your diet and lifestyle can lead to changes. So thank you very much. I'm sorry it took longer than I expected. I hope that we can have a few questions when we're all done.
Thank you, Dr. Etemad. So we have several questions that came through, starting with what are effects of alcohol on a person with diverticulitis? How much alcohol is too much?
So, I guess a little bit related to the microbiome, what we know is that alcohol is a drying agent, and alcohol can have various effects based on what your alcohol level is and how often you're being exposed to alcohol. So, specifically to diverticulitis is a condition where these pockets in the colon become inflamed and inflammation can either be generated by stool that is hard and dried up inside those pockets, or that the lining of the colon becomes more predisposed to what's already there. So we don't have a specific answer as to how much alcohol plays a role in diverticulitis per se. So I don't have a good answer to that question. I would generally say, though, that if you're getting inebriated from alcohol, you're reaching a threshold where there is impact on multiple tissues. But I don't know of data that says that getting inebriated is associated with a higher risk of diverticulitis per se.
As a woman navigating perimenopause, there are hormonal shifts that seem to impact my IBS and GERD flare-ups. Can you speak to how fluctuating hormone levels affect the gut biome and digestive function and what can be done?
So it's a great question. And clearly, as our population has been getting older and people are living healthier lives, the IBS that they may have had less of, let's say, as a young person, may be getting worse as we get older. And I don't know that there is enough data to say that we can manipulate that with a microbiome manipulation. That is, there are hormonal changes associated with how you feel the irritable bowel that you might already have. And there may be changes related to the lining of the colon as you're getting older that may make it more likely for that lining to get infected in the pockets of the diverticuli. But this is another I don't know. I don't have enough data to give you an answer to say that we can manipulate the microbiome. I'd say in general, let's stay with looser stools, healthier diet, higher fiber. But beyond that, I don't have a good answer.
Can fasting help the GI tract? Do colon cleanses have any benefit?
So I'll answer the second question first. Colon cleanses, I'd have to know exactly what is meant by it. If colon cleanses mean doing a colonic, I'm not very much in favor of colonics as a gastroenterologist because I believe that the introduction of liquids into the colon in that way and the different liquids that are used can often be irritating to the colon mucosa and the mucus layer of the colon. So a cleanse from below, I'm not much in favor of. A purge from above using, for example, some type of laxative, in general, the aggressive use of colon cleansing is not necessarily associated with better health. There's nothing to support that idea that you're ridding yourself of toxins. So I that question, I'll leave the answer as it is now, and we need to be more precise to better understand what the situation might be, as to whether or not it would be helpful or not, or what it is that we're talking about.
Are probiotics beneficial? And if so, which ones do you recommend?
Yeah. So it's a great question that all of us here in the GI department are asked by all of our patients. And I have to go back to say, it really depends on what we're trying to benefit. I think the generic statement, probiotics are beneficial, is not a clean is not a clean statement, because it's almost like saying, well, are vitamins helpful? Well, it depends on the context. It depends on what we're trying to help. So probiotics need to be used selectively in certain situations. And the type of probiotic that is used, whether it is Saccharomyces, whether it's Lactobacillus, whether it is some combination of these, whether it's a bifid bacteria, each of these has a potential benefit, but it really depends on the disease state.
Is there a diagnostic test to show the health of one's gut biome?
That is an excellent question. We recently came back from our meetings in San Diego, our digestive disease meetings. At this time, there are many, many companies that offer testing. Unfortunately, they're inconsistent in their results. And so right now, I'm not comfortable to answer the question that there is a singular company that is providing reliable information on the microbiome. Stay tuned. I have a feeling that we will be measuring products of the microbiome, and that might be more helpful. But at this point, it's very difficult for me to measure one person's microbiome against another. Remember, two people might have very different microbiomes, but if the products of those microbiomes are similar and healthy, then we may very well be perfectly fine. So taxonomy does not necessarily imply disease or health.
Dr. Etemad, can you speak to any interactions between GLP-1 receptors
Agonists.
and gut health? Maybe repeat that question.
Yeah. As you know, these GLP-1s have been around for a long time. The week-long GLP-1s and the ones that are being used more for diabetes and weight loss are out more frequently being used right now. GLP-1s slow down the gastrointestinal tract in general. Slowing down the gastrointestinal tract will lead to an alteration in microbiome. We have seen data that suggests that these patients are altered, but remember, often they have other underlying diseases. So knowing by itself whether or not the GLP-1 is the cause, or it's the underlying disease state is uncertain. So I think the jury is still out as to whether or not we would implicate a GLP-1 as the source of dysbiosis, or it's an underlying disease state. That's the issue.
Does Mylanta for GERD have an adverse effect on the biome like PPIs?
So Mylanta in general, remember there's different formulations of Mylanta, but in general, we don't see the same impact. We shouldn't see the same impact, because the period of time that Mylanta suppresses acid is going to be less than a PPI. So the hypothesis, I haven't seen direct data on Mylanta per se, but I'm going to hypothesize that it would be less impactful on the microbiome.
Great. So we are at time now. So
Okay.
last question, where do you see patients, Dr. Etemad, and how can you schedule an appointment?
So I see patients here at the Gastroenterology Center at Valley View Hospital. The information should be available on the internet on our website, the Valley View Hospital website. Um, and all of us are here ready to help you to sort some of these issues out. Thank you very much, all of you, for coming today. We'd love to hear your feedback on the presentation. If you have time to fill out a quick survey at the end today, it'll appear right after the webinar has ended, and you'll receive an email, all that have registered, with the recording of the webinar today within the next 24 hours. Very much appreciate your interest. Take care of your microbiome.